you all so much for joining. And if you've joined these in the past, glad to have you here again. And if you're new, we do have these all recorded, like I said, on our Praxis playlist, which we will be sending out in our resource email after the session is done. But my name is James Heckner. I work for Praxis Spinal Cord Institute as a regional community liaison out here in the fabulous Okanagan. I do have a spinal cord injury of 28 years, T6, age A, and super excited about this webinar here as well. I have utilized the services in Vancouver at Sexual Health Services. And actually, interestingly enough, my wife is a documentary filmmaker. She's also made a brief documentary, 20-minute documentary on the infertility and sperm retrieval. Geez, that's got to be going on about 8 years now. So we will include that in the resources as well. But thank you very much, and really looking forward to an informative session. I will pass this over to Emily.
Hi everyone, my name is Emily Giroux and I am a research associate with the Praxis Spinal Cord Institute. Part of my role here today is to support the organization and to support your learning and helping us understand how we can best support your learning through these webinars and other workshops that we offer. You might have seen already that there is a link in the chat for a pre-survey. It would be great to have everyone take a moment to just fill that out. But thank you for joining today. Excited to be here, and I will pass it over to Shannon Rockall.
Hello, everyone. So I'm Shannon Rockall. I'm an occupational therapist. I work clinically throughout the province, working with people with spinal cord injury. I also work together with James and Emily at Praxis Spinal Cord Institute, doing education, clinical education on spinal cord injury. And yeah, we tour around as much as we can, and when we can't, then we're back here doing their webinars to be able to extend the knowledge and confidence of clinicians working with people with spinal cord injuries in the regional and rural areas of BC. So thank you so much for coming today. This is always a hot topic. People, pun intended, always want to know more about sexual health and spinal cord injury, and there's not a lot of knowledge out there. So we have the experts with us today that are going to be talking more about that and teaching us all. Before we get started to that, I would like to acknowledge that Praxis Spinal Cord Institute works on the land in which we host this webinar is the unceded traditional territory of the Silk Okanagan Nation. We acknowledge these lands and also recognize that this webinar covers the province and that many people are located on different territories, and we welcome you to put the territory that you're joining us from in the chat. We'd like to acknowledge that. I also just wanted to share a little story about today. So on this day, just 5 years ago, on December 18th, 2020, a 10-year-old, Isabella Kulak, a member of the Cote First Nation, was shamed by a staff member at her school in Saskatchewan for wearing a traditional ribbon skirt during a formal day. The incident sparked a massive global movement of support for Indigenous cultural expression. This event directly inspired the creation of National Ribbon Skirt Day, which is now officially observed across Canada every year on January 4th. And I just wanted to share that again as an opportunity to learn and extend our knowledge of towards reconciliation. And over to you, Emily.
Thank you, Shannon. So I mentioned this briefly just when I was introducing myself, but if you haven't had a chance to click on the survey link in the chat, or if it's easier for you to pull up your phone and access the QR code on the screen, we would greatly appreciate if everyone took some time just to complete our pre-workshop survey. Like I said, we're really passionate and dedicated to ensuring that the learning opportunities that we're providing really are tailored in terms of content and delivery to best support your learning and application in the future. And these evaluations are really helpful for our organization as well in ensuring that we can keep offering these opportunities for you. They're very valuable for our sponsors and our funders. So we would greatly, greatly appreciate the time to complete the surveys. And yeah, again, just for your best benefits, we'll probably give everyone maybe another 30 seconds or so to finish this up, just because we want to get a sense of where people are at before we get into the fun part and our wonderful guest speakers for today.
Okay, thanks so much, Kate. Over to you.
Thanks. That's my cue. I see the slides. Welcome, everybody. It's my great pleasure to be here with Cheryl this afternoon. Thanks for beaming in. A big thank you to Praxis and James and Emily and Shannon for organizing this. And I just wanted to mention there'll be a time for Q&A at the end. My name's Kate McBride. I'm a clinical nurse specialist with the Sexual Health Rehab Service here at Vancouver Coastal Health. And Cheryl, I'll let you introduce yourself.
Awesome. Thanks, Kate. My name is Cheryl Newman, and I'm so grateful to be invited to today's presentation on sexual health and well-being after spinal cord injury. I'd like to give a little introduction about myself. Is this the right cue? For the past 28 years, I've navigated life with an incomplete spinal cord injury, T2 to T7, caused by an arteriovenous malformation when I was 23. While I have no motor function, I do have slight sensory function that is often heightened by pain. But because I sustained my injury in the Philippines, my journey from initial treatment to rehabilitation was quite different from someone injured here in Canada. This has given me a unique wealth of lived experience from both worlds that I'm honored to share. Before my injury, I practiced as a registered nurse in the Philippines. After becoming injured, I started a foundation named Spinal Cord Injury Foundation to support Filipinos with spinal cord injuries, walking alongside them through our shared struggles. So in 2007, I moved here in Canada after marrying my husband, Christian, who is a Canadian citizen. So now we have two teenage boys, ages 13 and 15. They definitely keep us busy. So professionally, I wear many hats today. I'm the volunteer management coordinator for the Disability Foundation Network, which is composed of 6 societies. And I am the Pacific Regional Coordinator of Tetra Society, overseeing the operations. I'm also an entrepreneur. I have Pandora Immigration Canada, where I work as a regulated immigration consultant to help others start their own new beginnings here in Canada. So before my current roles, I serve as a peer support coordinator with Spinal Cord Injury Ontario, formerly known as Canadian Paraplegic Association. So our office was based in Lyndhurst within Toronto Rehab. That allowed me to work directly with spinal cord injury patients during the recovery. I also supported clients at Sunnybrook, St. Michael's, and Toronto Western Hospital, guiding them from the early days of their injury, even while they're in ICU, through rehabilitation and back into the community. So together we explored, the essential aspects of life with a spinal cord injury, from the simple things from bladder and bowel management to sexual health, partnership, parenthood, and others. So it is a great responsibility to share the lived reality of this journey. And I hope today I get to contribute something truly meaningful to our conversation. All right. Back to you, Kate.
Thanks, Cheryl. Yes, you can tell why I'm so grateful that Cheryl agreed to present with us today. Just such a wealth of experience and background to share. So before we get started, we're going to ask you all to do a little self-reflection. Yes. So on a scale of 1 to 5, and I think Emily's going to do a poll for you to answer this question. So think about from a scale of 1 to 5, where 1 is not at all confident and 5 is very confident. How confident are you to talk about sexual health with your patients? We'll get a little temperature check here before we start. And I think it's anonymous. Yes, it is. So I think the results are coming in. That's great. So I think that's great, Emily. Do you want to show the results? Are you able to show the results? So scale of 1, okay, so it's leaning towards the low end. So the confidence is not quite there. The highest response is not at all confident, if I'm reading that right. Okay, so that's why you're here today. Perfect. Just want to make sure we're on the right track here. So next slide. Here's what we have prepared to speak with you about our objectives for the next 45 minutes. We are looking at the meaning of sexuality and sexual health, the importance of addressing sexual health and well-being, particularly in this population of clients with spinal cord injury. We're going to hear about examples of how people successfully adapt to the sexual changes they experience. I'm going to give you some tried and true frameworks and tools, strategies for recognizing and responding to sexual health concerns. And finally, we're going to leave you with some resources and opportunities for further learning. And just a note on the language that I use. So we, in sexual health rehab, we attempt whenever possible to use inclusive terminology, inclusive of all genders. That said, a lot of the literature to date is largely split into like male and female or both. So I might use or slip into binary terms in relation to that work. Next slide. Our service, so you can see it was established in 1975, so it's our 50th year anniversary this year. Hopefully people on the webinar have heard about our service. We work out of GF Strong Rehab Centre and also the Bliss and Spinal Cord Centre here at Vancouver Coastal Health on the unceded ancestral territories of the Musqueam, Squamish, and Tsleil-Waututh peoples. And I think you can click on the team. There's a picture of our team next. I'm going to forward the slide. Oh, go back. Sorry, go back. Wait, obviously it doesn't work. That's fine. I just wanted to point out here that we see anyone living in British Columbia. We take referrals from anyone with a neurological illness or disability who has specific rehab goals that would benefit from our assessment. So actually, the majority of our people do have a spinal cord injury. I'd say around 60%. We also see people with, after a stroke, a brain injury, Parkinson's, ALS, muscular dystrophy, and so on. And you can see our team here. We're made up of nurses. Our background is nurses with specialized training in the area of sex and disability. And the person in the center with the pink jacket, that's Dr. Stacey Elliott. She's our sexual medicine physician consultant and very well known in the area of sexuality and spinal cord injury and disability. Next slide. So I mentioned we take referrals from throughout the province. So I'm pretty sure anyone on the call could initiate the referral. We do require a physician or nurse practitioner to fill out the referral form, and here's the information, and you can email me at the generic SHRS email if you require more information. But most of the information is on the VCH page. And what clients can expect is we offer psychoeducation and tangible medical support within a safe, confidential environment. We provide support, create space, give permission for people to address this area of their lives. We see partners as well. And I know this phrase is overused, but we really meet people where they're at, and we focus on what their concerns might be. Next slide. And if you happen to be on a Cerner site, these are the complicated directions for that. But again, if you need those, you can reach out to me and I will happily send them along. The next slide. So let's brainstorm. What words come to mind when you hear sexuality? So I ask this often of all audiences, and it's very interesting what comes out. I asked a group of clients, said, do you have strong recently? And a woman put up her hand and said she had a recent spinal cord injury. And she put up her hand and said, it's the essence of who I am. So I thought that was very interesting. How she described her own sexuality as the essence of who I am. So we've got intimacy comes out. I'm so happy this group put intimacy as part of the definition of sexuality, because oftentimes we forget about that piece, and it's such an integral part of who we are and how we express ourselves, is that intimacy. And when I think about intimacy, there's all different types of intimacy also, right? There's the physical intimacy, but also the emotional and even like the intellectual intimacy. So even that can be explored at length. Okay, I think we can close the poll now, I'd like to save that though. I'm sure Emily can figure that out. So thank you for participating. And all those words, I think when you look at the center, we call this the wheel of sexuality. A lot of the words that you came up with, they fit into this wheel of sexuality, and they illustrate that biopsychosocial components. So it's not just the physical function, but it's also the expression, relationships, pleasure is a big component of sexuality. Fantasies, how we communicate with each other, our values and beliefs. So the sexual rehab approach is very much a biopsychosocial approach. It's part of a comprehensive rehab program. We really take into consideration the individual's values, beliefs, and how ready they are to address this area. And with that in mind, there's no time limit on our service. Sometimes, like I've been called into the ICU to see someone who's had a new spinal cord injury, to talk to them about the ability to have children, say, or their ability to be sexual again with a partner. So we might intervene at that point early on in their recovery, and then maybe not speak to them, meet with them again till they're in rehab, active rehab, and then maybe not again until they meet a new partner or they're ready to have children. So there's no time limit on our service, and that's a really important piece that people are very appreciative of. Next slide. So let's look at a little bit about sexual issues, sexual problems. It's important to note that generally in the general population, sexual issues are not uncommon. And then if you add a chronic illness or disability, it just increases the likelihood of sexual problems. And I just wanted to point out, like, listen to the stats here. The survey of 154 people, 75.5% reported sexual function problems due to spinal cord injury. Of course, that's just sexual function. It's not even talking about the broader biopsychosocial aspects of sexual health, right? So it's important to notice it's not talking about pleasure or how to manage bowel and bladder or pain or any of or self-image or any of those things that Cheryl's going to speak to in a moment too. Next slide. So sexual problems are common. Are they a priority? Yes. So this survey of the spinal cord injury population identified that, in fact, when people with tetraplegia ranked the priority, so say sexual function, arm and hand function, bladder and bowel, etc., walking, they actually ranked sexual function as second after arm and hand function. And then if you look here at persons with paraplegia, they rank sexual function as the highest priority. And this survey and results have been replicated over the years in many different studies. Next slide. However, so we know it's important, we know it's common. Do we talk about it? What do people think? Probably no. So it's just like this cartoon. We're waiting for the other person to make the first move. So meaning that we're at a stalemate. And the literature bears this out also, that we don't often bring it up. Even though we know from the literature that patients do want the healthcare professional to bring the topic up. Next slide. So any ideas? This is another poll. Why don't we talk about it? Any thoughts about why we don't talk about it? What are the barriers for clinicians, nurses, social workers, OTs, psychologists? So pop your ideas into the poll. Okay, so we've got awkward, embarrassing, incompetent, okay. Cultural, yes. Cultural, like we're talking about values and beliefs aspect. Not sure where to start. I feel like this group has read all the literature already. Culturally, yes, we hear this a lot. Did time come up there? Time's often a big one. I don't have time. I'm going to open a can of worms. All those things come up. Okay, that's great. We can close the poll. Fear, I see fear. So this is what the literature tells us. And I think you've hit on all these ones. I'm not going to take any more time talking about this because we are going to tackle those barriers now. So one of the ways we can tackle this is by giving you a tool, and it's called the Sexual Rehab Framework. And this was developed by the founder of our service, Dr. George Saz, and based on clients' concerns over the years. So how you use this framework is you identify what are the potential sexual issues, sexual areas that might be impacted by, in this case, a spinal cord injury. What are the consequences? And you can write them down, and then look at those consequences and think, okay, what are the possible interventions and who best to be involved here? Because we know from our work that the best approach is an interdisciplinary approach to sexual health rehab. So next slide. So I'll give you an example. We'll go through them one by one, and Cheryl is going to beam in and share her experiences as well. So some of the ones, issues that come up are around desire. So just a couple of takeaways with desire is, one, that it can be primary sexual desire, and two, it can be secondary. Most commonly, it's a secondary cause for low sexual desire due to things like self-esteem changes, bowel and bladder issues, pain, fatigue, and so on and so forth. And we'll talk about those in a minute. So what to do about them is very complex. We do a full sexual history taken and assessment if this is the primary concern that people have, but also we might pull in psychology or a sexual medicine or a counselor depending on what the underlying cause is. It could be biological. So oftentimes after spinal cord injury, men experience low testosterone. So it's important to rule out the biological cause for low desire. Yeah, so like I said, it's complicated. Next slide. A little bit about sexual function. When I talk about sexual function, I'm talking about sexual response. So that's sexual response to stimuli. So we're talking about genital sensation, body sensation, orgasm, ejaculation, erection, all those. And it's important that these sexual issues are validated and that the person has an avenue to talk about what they're worried about. And bottom line is there are a lot of therapies and treatments out there to help with all these sexual changes. And the people that couldn't help are nursing. I don't know if there's any nurses on the call. Physiatry for sure, urologists. We talk in the Sexual Health Rehab Service, we talk about this area a lot as well. Next slide. And for some background, when we describe the sexual response, we're talking about two main different pathways and 3 different nervous systems responsible. So there's the, we call the psychogenic pathway. So from the brain, thoracolumbar, it goes through the thoracolumbar area and then triggers the genitals for blood flow to come into the genitals. And then the second pathway is through a reflex pathway. So you describe this as someone touching the genitals, so through self-stimulation or the partner stimulates the genitals. And then the messages go to the sacral part of the core, so S24, and then sends messages back through the pudendal nerve to also trigger the blood engorgement. And then there's also an inhibitory pathway from the brain that can inhibit that sexual genital response. So depending, you can see from this illustration, depending on the completeness and the level of the spinal cord injury, it will sort of dictate what function the person has. Next slide. So what to do about it? There are, like I said, there are lots of different therapies and treatments. These are a couple of treatments that have been researched before. People with some genital sensation might have potential response to the eros, which is, I don't know if you click the slide, there's a little picture of a little vacuum device. So it's a little clitoral vacuum device, and they have researched this as well as vibrators for women with spinal cord injury, with some positive outcomes in terms of sensation, arousal, and orgasm. Lubrication can be really helpful. Just make sure you inform your clients not to use any like flavored or warming or colored lubricants. The orgasm question oftentimes is altered after spinal cord injury because of the reduced sensation. It might take more time and stimulation, but importantly, non-genital orgasm may be possible. And I'm gonna, in a moment, I'm gonna hand it over to Cheryl to talk a little bit about how we do that in terms of body mapping. Next slide. And you can click on the options here. So these are just the options for erection enhancement for men. So the bottom line is we can find an option that that will work for the client. And we usually start with those phosphorylated PD5 inhibitors and like least invasive and go to more invasive. Next slide. So on to talk about the next component of the framework, and that is fertility contraception. And I'd like to invite Cheryl to share some experiences around these areas, and maybe dispel some of those myths, because there's so many myths, I think, Cheryl, wouldn't you agree, in terms of like ability to get pregnant? Or I know one of my colleagues asked her physician, this is many years ago, if she could get pregnant and have a child, and they totally dismissed her. And that really set her back in terms of her own confidence to become a mother.
Yeah, Kate, thanks for inviting me to share something on this one. Like on my personal experience, I didn't had that a problem or way of thinking that I'm not gonna conceive, but just to share with the group, personally, it's actually good that there's a sexual rehabilitation framework that is being done here in BC, but in other areas where there's not a framework or an organization that can help people with disabilities discover if they potentially can have pregnancy, it's going to be a struggle. In my situation, when I got married, I actually lost 2 pregnancies before I got pregnant. So the first pregnancy, I lost it when I was in the Philippines. Then when I came here in Canada, I lost the second pregnancy. Fortunately, since I was here already in Canada, my physiatrist and my urologist, when I met them at Toronto Rehab, they evaluated everything that I have, and it turned out one of my medication is not conducive for me to get pregnant. So at the time, I was taking baclofen, what's that? There's an antibiotic just so that I don't get infections, and 2 other kind of medications. So what I did just for me to conceive, I went cold turkey. Within 9 months, I tapered all of my medications so that I can get pregnant. So I live with chronic pain. So every time I get my period, I would be crying because I'm sacrificing myself just to get pregnant. But and I even like use those fertility, the pregnancy, not pregnancy tests, those tests that would see if you're fertile for for that day or for that week. So I went through that. There was one time when I was fertile that I was inviting my husband, okay, I'm fertile today. And then when we were doing it, my husband could not deliver because he felt like it's life and death. And so he could not perform, right? So eventually what I did was I relaxed a bit. Like I just decided not to pressure myself to get pregnant, especially because it's hard on the guy. They said when you know you're fertile, don't tell your husband. Just seduce your husband because it's more pressure for the guys than for yourself. So yeah. And it just so happened when I just decided I'll focus on my career and I relax a bit. And yeah, when it happened, I got pregnant. So yeah, however, during the pregnancy, it was a difficult journey for me as well as a person with spinal cord injury, having complications with AD and all of that stuff. But I was able to manage, I guess, having the medical background, being a registered nurse, and reading through books as well as working with professionals, with the physiatrist, my doctor, nurses, all the clinicians who can support me. That quite helped significantly. And yeah, so having people by your side who would tell you what to do or help you out, it's quite refreshing because like for myself, I don't know what I'm facing getting pregnant or even giving birth. I just shared with Kate the other day as well, when I gave birth and because my level is T2 to T7, I'm high paraplegic. I had the challenge with breastfeeding. So during my breastfeeding, I couldn't produce a lot of milk. I would pump and pump and pump, and I wouldn't even feel 200 ml of milk. And my son would just gulp it in just less than 5 minutes. So I have to like do mixed feedings. So when I came here in Vancouver, I met my physiatrist, Dr. Krashakov. And when at the time, I just gave birth on my second one. And then I was explaining, yeah, I'm having difficulty producing milk. And then he did say, oh, that's not a wonder. You're T2 to T7. You're not supposed to produce milk. And I was like, nobody told me that when I was in Toronto. Like, it's just here in Vancouver that we have the team of healthcare professionals who are focused on all of these issues for people with spinal cord injuries. So yeah, and I was like, I devoted a lot of time and effort pumping my breast, and I'm not even supposed to produce a lot of milk. I even took like herbal medicine like fenugreek and all of the stuff to produce milk, and like made a lot of soup that other mothers are talking about. But yeah, so that is my experience when it came to pregnancy. Pregnancy and parenthood can be challenging. It has been challenging as well, but I guess that would be another topic.
Yeah,
I hope
think
that
yeah. Thanks for sharing that, Cheryl. Like, yeah, when you told me about the breastfeeding, your breastfeeding experience, I mean, I wasn't surprised, sadly, but yeah, it's quite powerful story, and I know you also made a video around it that people can watch on the Skyer site, and that'll be part of the resources that you'll receive after the webinar. Maybe move to the next slide, because when Cheryl and I were talking about this topic, there's just so many topics that you need to be consider for people with spinal cord injury, and but also I know you mentioned that our group and Dr. Krasikoff, we worked on the consumer breastfeeding guidelines for people with spinal cord injury. It's also our job to get the information out there, right? So that we don't want to be the gatekeepers to this information. We want to make sure that we work with the people with spinal cord injury and organizations like Praxis and Spinal Cord Injury BC and then disseminate this information so people don't go through what you did, right? And sort of beat yourself up about, like, I'm a terrible mother. And we hear that a lot, right? When there's a explanation for it. But yeah, so all these areas you want to consider when you're going through the framework. Also, there's, like I said, there's some really good information on our website, which is scisexualhealth.ca, and we made this in collaboration with people with spinal cord injuries and peers with SCI BC. And there's also great information on the spinal cord injury research evidence websites, and you'll get a link to that later. I think, can we go next slide? Yeah, I'll move on, but for the changes to ejaculation for men with spinal cord injury, oftentimes the number of sperm is similar to pre-injury, but it's the quality of the sperm that changes. And of course, and the ability to ejaculate can change as well. So, but it's still, we tell people it's still possible to have a child. So it may involve some advanced reproductive technologies, such as in vitro fertilization. At the sperm retrieval clinic, we do trials. We do two different procedures to help with the ejaculation. One is using a vibrator, and the other is using it's called electroejaculation. You can see it on the right-hand side there, the probe that goes into the rectum. And we usually reserve that for people that have sensation in that area that's usually works, the electroejaculation. So that enables us to get a sperm sample. Some people have learned to do trial vibrators at home. the vibrator just really needs to have a high frequency and amplitude. So that vibrator that you can see in the picture, the Ferticare, that's specifically designed for people with spinal cord injury because it has a very, very high amplitude and frequency. And it's over, I want to say it's like around 1,000 Canadian, around there. So it can be prohibitive to people. Next slide. Oh, and I should have mentioned the sperm retrieval clinic is part of our service. So a referral to us, we can take it to the sperm retrieval clinic. On to factors related to the condition. So I see in the chat, Shannon wrote AD is autonomic dysreflexia. So this can be something to consider for people with spinal cord injury during sexual activity, because it can be really disruptive. People also can use it in a positive way in terms of their feelings of arousal, but you just have to be cautious because it can be dangerous if the blood pressure does go too high. So some other factors, like I mentioned before, is pain, neuropathic pain, fatigue, spasms. These can all interfere with how the body's sexual response works, as well as desire. Right? You might not be motivated to be sexual if your spasticity is quite bothersome. Some people are worried about like those spasms disrupting their intimacy with their partner, or they're worried that they'll need their partner or hurt their partner or something because the spasms are so strong. So we can look at interventions in terms of how do you manage your spasms generally, like medications or non-pharmaceutical methods, and can you incorporate that a little bit into sex play and sexual activity. So these are some of the disciplines that might get involved with these factors. Next slide. So for motor and sensory changes, if you think about the level of spinal cord injury and level and completeness, and what the mobility in terms of sexual positioning, say, in terms of holding a device, in terms of massaging their partner, what have you, and then also their ability to feel different parts of their body. So here's some of the things that you can move to the next slide. So here's just a few of the options. We have created this Pleasure Able manual, the yellow booklet there, and you can access that online. We're developing a second, newer edition because this one's quite old. It's like 2009 or something. So a lot of the devices are different now, and so we're hoping to launch that in December of next year. We're running it through focus groups right now. This intimate rider was developed by a fellow with spinal cord injury. It has a more shallow seat so that the partner, so they can access their genitals more easily. It costs about $500 for the seat itself, and the bench is another $200. But lots of options. So I think if you're a physiotherapist or occupational therapist, you can really explore these adaptive devices to support your patients with spinal cord injury. Next slide. And here's a few more gadgets and gizmos. Again, like it could be about self-stimulation, but also to take a more active role in stimulating your partner. Next slide. And you can maybe open up slide. And I mentioned that, oh, go back one. Yeah. So I wonder if, Cheryl, I mentioned the concept of body mapping. I wonder if you could speak to that. I know we talked about that and how important it is to explore and be open-minded to different parts of your body in terms of pleasure.
So yeah, as I shared with you the other day, with myself and with the other clients that I've met, body mapping is for people with spinal cord injury is very important because it depends on the level of injury that they have. So if you're talking about a person who's quadriplegic versus paraplegic, you gotta find which zone in your body has more sensation that you can rouse, or it's what we actually call the E zone. So like for example, for women, if the women has if they're paraplegic and the level of sensation is above nipple line or up, so you got to find which tickles her the most. If this person is complete, doesn't really have sensation below the level of injury, but she wanted to indulge in sexual pleasure. She probably is more ticklish on the ear or on the neck. So that's where the partner should focus on, because let's admit it that sex is also psychological. If you know how to trigger that point, then having sexual relationship can be pleasurable. So discussing this with my clients, that's how I would explain it to them as well. Whether they're quadriplegic or they're paraplegic, find your E zone. If you think that's the one that can brings you pleasure, then the rest is sort of the imagination of your mind. Then you can enjoy it with your partner.
Thanks, Cheryl. Yeah, and part of that and mindfulness comes into that too, right? That's being shown through research to be very, very important, an effective way to sort of reestablish those pathways and that neuroplasticity piece as well. Next slide. So for people with spinal cord injury, the alterations, how they manage their bowel and bladder can definitely impact the sexuality, their ability to engage in sexual activity. And it's a lot of times is that fear around having accidents. So when Cheryl and I were talking about this, we spoke about the importance to plan ahead, to talk to your sexual partner about the potential for accidents, to talk to your care team about ways to better manage bowel and bladder. So we talked to a lot of people about that part. I'm just gonna move quickly through the next couple because I'd like time to talk about what you can do in your role. So we referenced body image changes already, and possible interventions do include mindfulness, cognitive behavioral therapy, and all of these disciplines can play a role in helping this with the sexual self-view and self-esteem. Next slide. And I mentioned mindfulness already. There's a lot of literature out there on mindfulness, and we've done a couple of studies for people with women in particular with spinal cord injury and women with MS, and seen the benefits of mindfulness in terms of their improved body image, stress, pain, quality of life. Next slide. So in partnership issues, we take into account if they're in a relationship, the significance of role changes in their partnership. If they have a care attendant, they need to talk to the care attendant about setting them up for sexual activity. So these are all aspects that we work with people, and other disciplines can be really helpful to sort through those complicated areas as well. Any last keywords, takeaways, Cheryl, for the group?
Yeah, so this is just a little sharing. I want to share with everyone an experience that I have. Like for you clinicians, whether you're a nurse, an OT-PT, the impact of you reaching out or opening this topic to a person with spinal cord injury can actually change a person's life. As an example, when I was working at Sunnybrook, there was this patient that came in. He was in a car accident. Day one, when he was in ICU, they called me. On day three, this person was married. Day three of having an injury, when he knows that he's going to be a quadriplegic, he was breaking up with his wife. They were just 3 months married when he had a car accident. So when they called me, I talk about his options, that life doesn't end there, that he can still have kids, they can still have a sexual relationship, a healthy sexual relationship, and that actually the information save their relationship. They stick it out and even until they go home. So as you, the clinicians, meeting clients like these, if you're open about sexuality, recognizing that there's a need of touching the topic, you might be able to save a person's sexual life. So that's just what I can share.
Yeah, and that was similar for Brent too, right? Like, yeah, we've had those experiences. Yeah, just opening that door. Thank you, Cheryl. Yeah, and my take home is just keep on learning. And thank you, everybody. And sorry I ran over time.
Thank you so much, Kate and Cheryl. It was awesome. There's never enough time to talk about sexual health, and in my experience, there's just so many avenues to go down. So that's fantastic. We're going to be sending out a list of a whole bunch of resources for you guys that hopefully you'll have and be able to save somewhere so that you have access to it and can learn more. Emily, did you want to speak to the evaluation survey?
Yeah, I just wanted to share that we've included a post webinar survey in the chat. There's also the QR code. We'll also be sending out the links to this survey in our follow-up email. Just again, would be great to see how this webinar has impacted you in any particular way. We'd love to hear from you. And then we also have the link to the Praxis People and Inclusion Survey. We're always working on improving access and benefit for all for these webinars. So would love if you have an opportunity to take time to fill out that survey as well. And that's all I have, and looking forward to hearing from you. And Shannon and James, anything else to end off with?
Yeah, just wanted to add, sorry, the importance, James and I are always fighting for airtime. The importance of doing those surveys and how the success of these webinars, that's how we determine and what's needed and moving forward. Also just wanted to do a little shout out to our next webinar that is scheduled for January 15th from 1 to 2 p.m. Again, Thursday afternoon. It's going to be with Dr. Kathleen Martin-Guinness talking about the spinal cord injury exercise guidelines and the clinical application of that. Over to you, James.
I just wanted to say thanks again, and I have utilized the services a number of times down there, and I can't say enough about it. It's even if somebody isn't necessarily ready to start learning about sexual health, maybe soon after their spinal cord injury, I can almost guarantee that a few months or even a few years post injury, those questions do start to arise, and we just have an unbelievable resource here in BC and highly encourage it. And also I mentioned there in the comments, if you have any questions, I know we had to cut Brent's video off short a little bit, but if you have questions, want to talk to me about it, just shoot me an email and I'm more than happy to talk about it as well. So yeah, thank you very much. Thanks, Kate and Cheryl, for everything. I learned a lot. Every time I learned something.
Yeah, and likewise, feel free to email my personal email too, if you have any questions at all about anything about our service and what we do. And thanks, Cheryl, for presenting with me today.